So my name is Shana Monique Davis. At the time, there was Shana Williams. I currently work at Prisma Health Toomey in Sumter, South Carolina, as well as Midlands Behavioral Health, also in Sumter, South Carolina, where I serve as the psychiatric nurse practitioner for Toomey and the lead psychiatric nurse practitioner at Midlands Behavioral Health. I've always had a passion for psychiatry, and it was due to my own previous trauma as a teenager in high school. And I always believed that even though a psychiatric patient has rights, they also have feelings. And just because someone is psychotic, just because someone is depressed, just because someone is experiencing mania, doesn't mean that they don't have a right to be involved in their decisions and involved in their overall what they're taking, why they're taking it, even if we have to explain that like several different times. And so that's what got me started with shared decision making. No matter the diagnosis, be it schizophrenia, be it depression, be it PTSD, patients want to be a part of the decision making that is with their care. And a lot of the patients that felt like they didn't have a voice before because hey, I'm coming in and I hear and see things now like, oh, so while that does matter, I still have an opinion. And it opened up so many different things like more adherence to medications. We did family treatment teams and, eventually got to the point where the patient really felt like they were connecting with us and they could dialogue with us. Um, as far as in other settings, I would love to see that. I would love to see it even in like some of the behavioral health urgent cares. We wanted to make sure that that question that was in the press ganey was, do you feel involved in your care, was answered for folks. Like, were they able to say by discharge that, yes, I had involvement in my care, and yes, it was a great way for me to go to this place, because they are collaborative. They do help me. They do understand me. They are trying to get to know me. Even at the time of the study, we were getting started with COVID. So, we did have to rely on more of did the patients feel involved in their care. It was very surprising to me that a lot of my patients that were psychotic were impacted and really felt heard, despite the fact that they may be hearing or seeing things or, having some delusions. Um, the other part was the press ganey and the answer to that question. I knew it would have some sort of impact, but I couldn't have told you how that would have changed the scoring of that question. It went from patients not answering that question to patients answering that question, but also having a very positive experience on our unit, on our inpatient unit. One, make sure that everybody understands what you're looking for and the buy-in. Like, do they believe in shared decision making? Do they understand what shared decision making is? Are there patients that would be receptive to that? Are there patients that would not be receptive to that? And even speaking to one of my barriers, were there providers that were receptive to that? Because just like I said, sometimes in psychiatry, it turns into, well, this is the course that we're going, and this is the treatment that they're going to take. Versus now it was with shared decision making, it's, hey, we have this thought about your treatment and we want to involve you in it. What are your thoughts? I would like a follow-up to it. I haven't figured out how I want to do that just yet. Um, because surprisingly, I didn't think it would get this far. And I just want to see, I would like to see it implemented in a lot of other settings. Don't be afraid to push that obstacle just a little further. It's been so many times I was asked to revise my project or think of it a different way. I really stood my ground and was like, no, this is the kind of project that I want to do. This is the direction that I want to go. And I wouldn't have done it any other way because I really want people who want help psychiatrically to feel like they're still heard. Because I think sometimes that gets lost between medications and therapy and truly understanding what someone is looking for.